Have you ever received one of those automated phone calls that notify you of food that you purchased recently as part of a Listeria outbreak, only to then realize you ate that food last week and you've been feeling a little bit off? Uh-oh, what do? I'm Dr. Katrina Coulter. I'm a board-certified infectious disease specialist, and I'm here to talk to you today about Listeria and hopes to provide you some information so you can decide what to do next. So who is really at risk? Infants and adults over the age of 65 are considered to be in the higher risk categories. Also, people that are on medications that compromise their immune system or suppress it, or have health conditions that suppress their immune system, are at increased risk to infections from this bacteria, and specifically invasive infections. And then the last category, which has a 10 times higher risk than the general population, is pregnant women. So pregnant women, I'm talking to you. If you had a Listeria exposure, you should be paying attention closely to this video. Listeria monocytogenes is a type of bacteria that is commonly found in soil and water and contaminates some food products. Listeria is a gram-positive rod, for those of you that are science nerds like myself, that survives well at cooler temperatures that typically would kill most bacteria. These temps range between 4 and 10 degrees Celsius. 4 degrees Celsius would be 40 degrees Fahrenheit, which is where we should be keeping our refrigerators. Listeria is also a bacteria that can live intracellularly, which means it can be a little bit hard to find when you go looking for it. But not to fear, there are ways that we can detect it. Foods that are commonly contaminated with this Listeria bacteria are going to be unpasteurized milk and dairy products, deli meats, deli sliced cheeses, smoked fish that has to be refrigerated, pâtés and other meat spreads, uncooked hot dogs, prepared salads such as potato salad, tuna salad, egg salad, chicken salad, or coleslaw. And it can also contaminate melon that has been cut, especially if it's been sitting out for more than an hour or it's been in the refrigerator for more than 1 week. Even enoki mushrooms eaten raw and raw sprouts have been implicated in Listeria outbreaks. The types of infection that Listeria commonly cause can be broken down into 3 categories. The first is gastrointestinal, the second is invasive, and the third is localized. Listeria gastrointestinal infections are estimated to only cause about 1% of all the bacterial gastrointestinal infections in the United States. However, it is responsible for about 1/3 of the deaths related to bacterial gastrointestinal infections. So it can be pretty severe. We don't really know that we have solid numbers on these because a lot of people have a mild illness and they won't present to healthcare. So they're never officially diagnosed. These usually occur about 24 hours after eating the food that was contaminated with the Listeria. However, there is an incubation period between 6 hours and 28 days. There are 2 main types of Listeria invasive infections. The first is a bloodstream infection, which will typically present with fevers and chills and muscle aches or pains. This carries a pretty high mortality rate of 20%, likely because it's so difficult to diagnose. The other invasive infection, called meningitis, is inflammation of the covering of the brain, and when it's meningoencephalitis, the brain is involved. This will present as a headache, nausea and vomiting, fevers, chills. There may be some changes to the person's mental status, or they may have a tremor or seizures or go into a coma. These are very serious infections. And again, they have a high rate of mortality. And so if any of these symptoms are present after a known exposure to Listeria, one should seek health care immediately. The risks in pregnancy are much more severe than to a general population. Typically, we'll see infections in the third trimester, and the symptoms may be mild, but the consequences are dire. So the symptoms may be abdominal pain, muscle aches, fever, diarrhea, or headache, but the consequence could be very severe. This bacteria crosses the placenta, so this can cause early labor or preterm birth. It can cause fetal demise, and it can cause neonatal sepsis. So again, pregnant women, pay attention. If you have had a Listeria exposure, you need to listen to your body and seek health care if any of those symptoms are present. The third type of infection that we sometimes see with Listeria are localized infections. And these are typically skin or eye infections from direct inoculation. Usually we'll see these in people who work closely with animals or in a lab. Wow, so that's probably a lot. This is a scary disease, but it can also be a very mild self-limited disease in an otherwise healthy person with a normal immune system. So what can you do to prevent this? The main thing to do is to keep your refrigerator clean and cold. So your refrigerator should be at 40 degrees Fahrenheit or lower. And throw out that food that's been in the fridge for more than a week. Nothing should be sitting open in the fridge for more than a week. You can also avoid unpasteurized milk and dairy products and heat any deli meats or hot dogs or other smoked fish to a temperature of 165 degrees Fahrenheit or greater, which is usually steaming. Additional tips include separating cut vegetables from cooked foods. And when you're at that barbecue or that potluck and the food has been sitting out for a while, 60 minutes or more, maybe avoid the potato salad and the cut melon and all of those deli foods that potentially could be contaminated. All right, folks. Well, hopefully you found this video on Listeria helpful. If you did, let me know in the comments and hit like or subscribe and share with somebody that you think may need to know this information.